My name is Patrick Tatum. I'm doing a diabetic foot exam for University of Alabama Huntsville Nursing 500 course. Today we're going. This patient is not a diabetic, but for exam's sake, we're going to pretend that she is. Okay. So first, what you want to do is have patients remove all their clothing from their knees down, including their socks or shoes, especially. You want to look for any ulcerations on the bottom of the soles, since that's closest to you. And move up to the toes and check out the nails for thickening. You want to look for ulcerations on the inside of the metatarsals and of the great toe. Callus formation is common in these two areas, so you want to check those definitely. Check for cap refill in the toes. Make sure that it is less than 3 seconds. Check the nails in general for being cut straight across and for any ingrown toenails on either side of the toes. And this patient does not look like she has any of those at this time. Check in between the toes for any fissures, moisture, ulcerations, any abnormal growth such as a yeast infection or athlete's feet. Check both feet for that. In between all toes, check the skin temperature from the thighs down to the feet. You can check pulses at this time. Check them both to compare equality. And she has good pulses in both feet. Check for, this would be the dorsalis pedis, and check the posterior tibialis at the same time as well. And she also has good pulses then. As far as sensation goes, the patients know that feel when you touch them as the closer you get to the end of the feet, because a decrease in sensation will lead to ulcerations, fissures, drying of the feet, cracking of the feet, something that they may not be able to know as well as normal people would as far as sensation goes, because once these ulcers develop, they continue to walk around on them and make them worse. Now that we're to sensation, you have a microfilament. You want to touch the patient somewhere where they have good sensation and where they can compare and know what it feels like. So I want to touch her here. You feel that?
Mm-hmm.
Okay, very good. And now you're going to have them close their eyes, and you'll touch them on the ends of all the toes, and then on the soles of the feet and different areas of the feet. Be sure to document where you touch them and the response of how they feel it.
I feel it. I feel it. I feel it.
I do different areas on the bottom of the feet.
Yes. 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 Yes.
Yeah, so she has good sensation in her left foot, and for the sake of time, I'm going to assume that she has good sensation in this feet as well. You're to check in the same spot in both feet and be able to document those as well. Next will be vibration. Have a tuning fork. Strike against hard surface and see if they feel it where you touch it and note the response.
Yes.
Okay, now strike in, and they're supposed to stop feeling it when you stop it.
I don't feel it. It stopped.
Okay. Now you're going to do the soft and the dull touches with a cotton tip applicator. Touch them where they can. They do have good sensations where they'll know what they're expecting. So this will be soft. This will be dull. Okay.
Okay.
So then close their eyes, and you'll touch them in different areas on both feet.
Soft. Dull. Soft. Dull. Soft. Dull. Soft. Dull. Soft. Dull.
It's important to note the response to the sensation on the bottom of the feet, since that is where the ulcerations can occur the most, and that's the hardest for them to examine on their own. Next will be reflexes. You're going to check the reflexes in the back of the heel, the Achilles tendon. Okay, check both sides. Okay. Make sure that the reflexes are present and note their quality. As a general rule, you want them to examine their feet daily. Wash them. When they wash them, examine them completely. Make sure that they dry them. And be sure to examine the bottom of their feet and dry in between their toes to check for any moisture, ulcerations, or fissures that may arise due to lack of exam. You want them to have a yearly exam, and if ulcers or calluses do appear in between visits, you want them to follow up with a podiatrist to have these cared for. Also, if they do have to get an ingrown toenail or for general nail care, you want a podiatrist to care for them as well, or a skilled technician that takes care of these things, if you're comfortable with those that are trained. Oh, lastly, you want to check musculoskeletal strength for equinus. You have to have them dorsiflex and then push back, and note the strength of the feet bilaterally if one foot's stronger than the other. And you also want to check for any amputations if they've ever had any. If they've ever had a amputated digit, they are increased likelihood that they may have another one. And I believe that concludes this exam.